I'm going to be administering my patient's insulin today. I'm going to first compare my physician's order with the MAR. So my patient is going to get 6 units of regular insulin and 16 units of NPH insulin. Okay, I'm going to identify my patient. Can you state your name and date of birth for me? All right, and then I'm going to perform hand hygiene, wash my hands, put on clean gloves. All right, and then I'm going to perform a focused assessment. I'm going to check my charting to see where my patient has last had their insulin injection. I'm going to assess the skin of the new injection site to make sure the integrity is good. I'm going to ask the patient if they are going to eat and verify that they are going to eat so that they need the insulin, monitor for signs and symptoms of hyper and hypoglycemia, and their level of consciousness, and I'm going to make sure that their blood glucose indicated that they need insulin. So my patient's last blood glucose was 252 milligrams per deciliter. So I've pulled my insulin, and I have NPH insulin and regular insulin, and I'm going to check the expiration date of both of these and ensure that they match the MAR. Okay, they match the MAR. So I'm going to roll my insulin, pop the caps off. I'm going to take an alcohol swab and wipe the tops of both of those very, very good to ensure that they're clean. Okay, I'm going to take my insulin syringe, and then I'm going to verify again that my patient gets 6 units of regular insulin and 16 units of NPH insulin. And we don't want to mix cloudy and clear insulin, so first I'm going to draw up 16 units of air, and then I'm going to inject that, making sure not to touch the base of the needle into the NPH insulin. I'm going to withdraw my needle. And then next, I'm going to inject 6 units of air into the regular insulin, ensuring not to touch the base of the needle. Okay, after I've injected the 6 units of air, I'm going to turn my vial over and then draw up 6 units of regular insulin. Next, I'm going to insert my needle into the NPH insulin, making sure not to touch the base, and then draw up 6 plus 16 equals 22. So I'm going to make sure that there are 22 units of insulin, and 16 of that should be NPH. All right, now that I have my insulin, I've verified again that it's 22 units. I'm going to carefully recap my needle if I'm outside of the patient's room, and I'm going to label my syringe with the patient's name, type of insulin, dosage, and then I'm going to get another nurse to verify that there are 22 units of insulin in my syringe, and then once I've come to my patient's bedside, I'm going to verify again for the 3rd time that my dosage is correct. Next, I'm going to, if I'm coming from the med room back to my patient's bedside, I'm going to take off my dirty gloves, put on clean gloves, and perform hand hygiene before I put on my clean gloves. And then I'm going to take an alcohol swab, verify my placement. So I'm going to go in the left outer quadrant, upper outer quadrant of the patient's abdomen, because the last injection was on the right upper abdomen. So I'm going to clean my patient's skin with an alcohol swab in a circular motion, making sure that it's all nice and clean. I'm going to take my insulin, verify once again and then take the cap off. I'm going to pinch the skin, and I'm not going to inject this because I don't want to harm the mannequin, but I would inject my insulin into the patient's skin at a subcutaneous injection. All right, and after I inject, I'm going to pull my needle out, discard of it into the sharps container, and then I'm going to take off my dirty gloves, and perform hand hygiene and document the procedure, the patient's response, and the signs and symptoms of the patient.